Good morning, everyone. I'd like to welcome you to First Baptist Church, our Penn Life Center, as we prepare for our When You See Something, Say Something, brought to us by lesscancer.org. I am the pastor here, Dr. Dwayne Brown. I also have the unique adage of being a forensic scientist and an emergency room nurse. So I'm very, very well versed in understanding the necessity for patient education and community outreach. And so being able to have this opportunity to speak to the community, to bring about awareness with cancer awareness, and also being able to partner with a well-known organization is perfect that we have this. It's a perfect time for this, as well as we get together, we meet with families, we can share this information with them as the holidays come around, and so we can have some good conversations at the holiday time and not talk about Ohio State winning the college football championship again. Thank you. I'd like to introduce basically the organizer and the facilitator for today, Mr. Bill Cousins.
Thank you. Thanks so much. I love that Michigan State does our continuing medical education credits, right? Right, that's all good. Anyway, welcome everybody, and thank you for being here. My name is Bill Cousins. I'm the founder of Less Cancer. We have been going for more than a couple of decades, and we were founded the work started in 2003, actually, and we were organized and received our letter in 2004. And our conversations 2 decades ago were unheard of. Nobody talked about ever lowering risk or preventing a cancer. It was unheard of. People didn't have information. And while I'm just a C student, these people are the experts. It was important for us to start having these conversations so people could become engaged with their health and communities could be engaged as well. So I wanted to not go on about me, but I wanted to open with a message from one of our board members, Yvette Bowser. Very interesting lady. And would it be okay if we played that now?
Hi, I'm Yvette Bowser, the creator of Living Single and a member of the board of Less Cancer. As we all know, some of the people we trust the most work in personal care. You're our hairstylists, our nail technicians, our barbers, people we see on the regular and are super comfortable with. And while you're not healthcare providers, you are often the first to notice if someone's skin looks different. And here's the thing. People with black and brown skin do get skin cancer. It's just unfortunately often detected later because it's harder to see. A dark streak under a nail, a foot sore that doesn't heal, a patch of skin that keeps changing color. So if you see something, gently say something and encourage your clients to get it checked out because you never know. You might be the reason someone catches something early. You might be the reason someone gets to live a longer, healthier life.
She's a great board member, and she has used her impact and her influence to help Less Cancer in a meaningful way. I want to introduce you to our chair. I don't know, is Tricia connected?
I can see you, Bill, yes.
Right. Well, there's this room full of wonderful people here in Warrenton, Virginia. Tricia's talking to us from Utah, and welcome.
Thank you. Thank you. I'm Tricia Petzel. I'm a family physician here at the University of Utah in Salt Lake City, and it's an honor to be here. And thank you. I wish I was there in person, but thank you for letting me attend in this fashion. I just a little bit of who I am. I work and teach integrative health, preventative medicine at the University of Utah, and teach food as medicine, a culinary medicine class. Prior to that, I had 18 years of emergency medicine practice, and now I own and practice in a preventative health and integrative health clinic. I also still ski patrol and work in a urgent care clinic at the ski resort. And and been part of the board of Less Cancer, and it's just an honor to take prevention out into the communities through workshops, through education, and so it's an honor to be here, and it's a important part of who I am as a physician at this point in my career, and I'm really grateful for it. And really, through all these different facets of practicing medicine, skin issues have always been there, and so I'm really excited today to talk about how they appear and how it's been part of my clinical practice throughout the years.
Thank you so much. I appreciate your leadership and all you do. If we can talk a little bit about the ER perspective, and that when you're in an ER and you're looking at somebody, if you see something on their skin, can you tell us what that might look like? What that incident, not what that thing on the skin looks like, but what that process is about.
Yeah, more often than not, when I notice something that might be skin cancer, or frankly an infection or some other skin abnormality, I have been treating them for something else. They haven't come in because they've noticed their own skin issue often, and so if I in my prior work in my family practice clinic, I would take a biopsy and send it to pathology and follow up with that person. In the emergency room, often I would in the system I've been working in, send them to a family practice doctor or a dermatologist who I knew would then get the diagnosis. Or sometimes I'd see it and it would look a little abnormal, a little raised, little discolored, and or an unhealing wound, as a vet was talking about, and I would send it to another person for a second opinion. And I think, I think about what she was talking about, of people in the community, not to be afraid. It might be normal, but if we don't say something because it looks different, then we won't ever know. And so there's ways to diagnose this. And so we would do it in a kind of a team-based approach is how it ends up working.
If you can explain to the average Joe why this early detection is so critical and why you act when you see something in the emergency room. Can you really illustrate why it's not something that we put off?
Yeah, that's a great question. That's a great point. When we catch something early, it often is isolated to the area of the skin that we're seeing it in. And we can actually have a curative, it can be cured by just cutting it out. If it continues and progresses, then it could spread through the body and be a much more invasive problem with much more morbidity and often mortality to it. I had one incident where a dark, unusual looking spot was on someone's heel, and with early biopsy was realized to be melanoma, which is a spreading cancer, and it was caught before what we call in situ, without spreading to the lymph nodes or into the bloodstream. So it was a long process of healing from the cutout of the wound, but it was done in a number of months and something that was cured. And so I think had that been ignored for months or years, that would have been a different story for that person.
Well, and it's, even in my job, it's hard to pursue all the preventative steps you can take. Because I'm closer to the sun and bald, spend a lot of time having my dermatologist stand on a ladder and burn things off my head. And so, but it's frustrating because I do it a couple times a year. It's never good news. It's like going to the principal's office. But it's so much better news than what it could be, what the outcomes be. And when Tricia, you had mentioned in situ levels. We had a family member recently somebody who went through that whole process, same level, same everything, but the amount of surgery, literally from the shoulder to the knee, to ensure the lymph nodes were okay and everything else was okay. It's quite extensive. So it is, I think people tend to put some of these things off, and I myself tend to put these things off. It's human instinct to not want to stand in front of a blowtorch or a blade, and so it's really quite critical.
I do like how Yvette said gently say something. I think the idea of us caring and looking out and caring for each other is such a critical piece to this this network we're creating here with this workshop. So thank you, Bill, for saying that.
Oh no, I appreciate it, and I love Yvette's message. She's so right on and smart on these things. Are there any closing tips that you can give to us lay people about this whole notion of when you see something, say something? Is this, how do you speak up to people in a caring way without really, hey, I want to talk to you about that third eye on your forehead. Like, what do you do? How do you approach these things?
Yeah, that's a good question. I think, when you know someone, even if you know them professionally because they come to you for a service or you work with them, or there's a trust there that it's as a patient, as a physician, it takes a while to gain trust in someone. And as physicians, we don't see people a lot. So I think people like to be cared for, like to be heard, like to be seen. And so when you say something that this looks unusual, I'm not a professional, but but it doesn't look right to me, and I really care about you, and I recommend that you get an opinion from someone, from a medical professional, and I think part of it is come from a caring point of view, and not you got to take care of that. You're wrong, or you're broken, or I love you, and this doesn't look quite right to me.
You always have the best approach. Thank you, Tricia. You're always so smart on this. And thanks for being here today. I hope you stay on to be part of this conversation, because hopefully we'll have some questions and people will want to talk a little bit. But thanks so much. Appreciate you joining us. So next, we have Monica Baskin. And Dr. Baskin came from New York last night to go to Richmond to switch suitcases and drive from Richmond to here today. And we are so grateful. Dr. Baskin has joined us on Capitol Hill several times, at least, I think, and is a board advisor. And because you will say it better than I, Dr. Baskin, can you please give us the elevator speech about who you are, what you do, how you do it?
Sure. So I am delighted to be here. Thank you so much. Thank you for hosting us here. I'm Monica Baskin. I am the Deputy Director of the Massey Comprehensive Cancer Center in Richmond. I was telling my panelists, I recently moved to Richmond from Pittsburgh in April of this year. So excited to not bring snow, as I have had about 3 years doing that, and was ready to come back south. So I am a native of Atlanta, Georgia, born and raised there, and then also moved from Atlanta over to Birmingham, Alabama, where I spent about 18 years there at the University of Alabama at Birmingham, and a senior leader in the Cancer Center there as well, focusing mostly on community outreach and engagement and behavioral research, and then spent about 3 years, as I mentioned, at the University of Pittsburgh in the Hillman Cancer Center, where I also led community outreach and engagement and became the deputy director before being recruited by Dr. Robert Wynn here at Massey in Richmond. So my work, I'm a psychologist by training. So the work that I do really focuses on helping people to prevent cancer. So hopefully that's the primary way that our work impacts cancer. And for those that we are not able to prevent, it is exactly what we've been talking about, being able to detect it early when we know that there's so many options available for people to have more birthdays, to have more celebrations, because they're able to live with that cancer. So that's most of what I do.
Well, you're good at it. And Dr. Baskin I knew her well before on her reputation, before I knew her personally, and before she became an advisor for the Less Cancer Board. She is well noted in her research, and we are always delighted to have her participate because she is a leading force, and we're grateful for you. So a couple questions.
Okay.
Why disparities in skin cancer detection persist in brown and black communities? Can you give us that overall picture?
Yeah. Absolutely. I think it's, some of what was already mentioned. A lot of times when we think about skin cancer, we're not thinking about people that look like me. So we're generally, the general public thinks about individuals who are white or fairer skin, and used to that presentation. And so those of us who have darker complexions, that's not something we grew up talking about, thinking about. I have my own family members that I have to really berate about using sunscreen, and because the idea is, my darker skin, I'm not going to be impacted, but you absolutely are. And so I think part of it is education and awareness that skin cancer can impact individuals even if you have darker skin complexion. I think the other thing is not only the individuals, but making sure our providers are also educated and recognizing that that is something they need to look at after as well. The other thing, I'm not sure, when the last time you've gone in for your annual visits, but a lot of times you're not necessarily disrobing. So there are places that your provider doesn't always see. So, I, for one, have very cold feet, so I never take off socks or stockings or anything if I don't have to. And so the base of your feet, in between your toes, or for those of us who like to have nails painted, those are things that are not as apparent, even if you are going into a provider, to be able to understand or see that. And that's why I think this initiative, and you'll hear from Caleb later on, is so exciting, because there are individuals that you're going to, whether or not you're a caregiver or you're providing some of these other personal care services, you're going to see something that even providers that are trained or may not see as early as possible. But I think it's education. It's both of the individual community member, but also the providers, as well as making sure that we're getting the word out and finding trusted people for us to talk to.
Which is great. Can we talk about what really motivates communities for screenings, if there's anything along those lines we could share?
Yeah, I would say that my work historically has been in a number of rural communities and communities of color. And what I've learned, not just from my own personal family, but what I've learned is that, thinking about prevention is not something culturally that individuals from those communities think about all the time. It's you go in when something is broken, and it's obviously broken or not working right. And so, part of it is motivating people to go in, get those screenings so we can have the early detection. But what motivates people in the work that I have done is really not so much about for yourself. Especially for many of the women in the room, I could say, we're always caregiving about other people. We're always thinking about other people. All of you are in this room because you are leaders in your community. And so I am sure, especially this time of year, you're giving more to your community, to your family, and more so than you're necessarily thinking about yourself. And so part of the motivation that we talk about is you want to be there for your loved ones. And there's no better gift that you can give them than for you to be healthy, to be there for those celebrations, to help out and so forth. So we really motivate people by saying, your first, the first ministry is at home. And part of that being at home is taking care of your vessel. And that vessel you have is your own body. And so we talk about motivating people for not just for themselves, but for their family, for their community, to make sure they're around their vital parts of the community. I think that's motivating. I think the other piece is something we've already started to talk about, which is this idea of feeling comfortable, feeling valued, not being talked down to. And so there's a motivation about a peer, someone that you really relate to, being able to have that conversation, even before the physician and patient conversation. I think that also motivates. Some of the programs we had in Alabama and Mississippi, we really train peers to talk to one another, to give key messages, to get people motivated, figure out what those barriers are. So sometimes they don't want to tell, other people, but, hey, you need a ride, let me give you a ride. Or you want somebody to be there with you to hold your hand. So those are the kinds of things that I know from our research that tend to make a difference and get people out and motivated. And one last thing, I happen to be a happily married woman. So again, we talk to the guys in our lives, and we kind of just take them. We hit them over the head and drag them. So that's a good motivator as well. Not all. That's right. Not all. But sometimes you need that extra nudge. You need to really say, nope, I'm making the appointment. You're going to go. I'm going to go with you in case there's concerns and fears. But again, those are some of the top motivators.
Well, those are good observations. I often think, even though founding this organization, that I'm actually pretty terrible at inspiring other people to go get care, because they're like, how tall are you? It's just like I'm not relatable to anybody. And so I'm never that person to make those kinds of recommendations, because it's easily seen as something very judgmental at my level, which is, So, this is a great conversation, because trusted spaces like a church are everything. And, I think about you being, a nurse in an emergency room and a pastor. You're like inside out guidance, right? And I love that you have that ability to build that trust, and also to share recommendations. And, that's the whole idea here. These are things that we can expand to personal care. Lots of people in personal care can do extraordinary things just by tapping somebody on the shoulder. And, so I wanted to move on just for now, and we'll be able to ask questions and work this up a little bit. Tammy LaGraff is somebody that's been in our lives for a while. We love her personally, and Less Cancer loves her. And Tammy is executive director from the Culpeper Free Clinic, the Free Clinic of Culpeper. My dyslexia has me saying it differently every time. And Tammy, can you give us an elevator speech about what you do, how that works, and let's hear a little bit about what you do in your space.
Okay. Thank you again for inviting me to this event. I love coming to Bill's events. Not like you can say no to him, but
Amen.
but I really think that the work that Less Cancer is doing is so important, and especially this one. This one really kind of hits home with me, because I think that we are supposed to be taking care of each other, right? And looking out for each other. And I think that when a person who is giving care to someone in a way, I remember one time a nurse instructor I had 40 years ago. I've been a nurse for 40 years. And I lived in upstate New York, Syracuse, snow country. So you don't think about skin cancer so much up there. We're more into the vitamin D to try and make sure we're. So one of my nursing instructors said to us, and it's funny how things stick with you, that her son-in-law, who was young, had passed away from skin cancer. And she actually is the one that discovered it because they were out at a lake and they were swimming, and he ran down the dock in front of her, and she saw something on the back of his leg. And she said to her daughter, he needs to get that checked immediately. And, we would not think about that. I wouldn't necessarily, if I wasn't a nurse, I probably wouldn't look at a mole on my husband's back and think, wait a minute, let's get that looked at. So I think this awareness, bringing this to our attention so that we're looking at not only if we're in a profession where we can, keep an eye on those things, but just for each other, right? That we're watching out for each other. In the meantime, yes, I'm from upstate New York. We've lived here about 6-7 years now. I've been a nurse for 40 years, and I took over running the free clinic right about a month before COVID hit. So that was an education. Yes. And it is my absolute favorite job. We serve individuals who do not have health insurance, who live in Culpeper, who are adults and meet certain income guidelines. And probably 90% of our patients are Spanish speaking at the moment. So we see varying levels of skin tones, but a lot of them are brown, some are black, and most of our patients are working outside. They are working in landscaping, they work at the growers, they work in tree services, construction, so they are outside a lot. And they also, because of the fact that they are struggling to meet, making ends meet for housing, for food, for transportation, medical care is reactive for them, like you talked about. It's not preventative. It is, oh, my foot hurts, it affects my work, I got to go to the doctor. It's not, you know what, I noticed this spot on my arm, I probably should have it looked at. That's not how they do things. They are surviving. They're really trying to just get through to the next day. And so prevention is not high on their list. So that is why we really try to teach a lot at our clinic about all of this, because it really is something that awareness is so important.
Well, and you're a great educator. I know that. Tammy has a really unique experience because I remember a project we worked on a few years ago. You'd explained to me that they have a translator, and you had told me that there were some dialects that you couldn't even translate because that's how diverse this unique population is. Mm-hmm. But the one reason, especially Tammy is here along with Rob, too, is access. Health access is everything on any kind of prevention. So if we're working to prevent diabetes, heart disease, or cancer, whatever it may be, it's all got to be about access. So then you hear, fast forward, we have Tammy LaGraff. She's the clinic of the free, the Culpeper, the free clinic of Culpeper. And what is the correct?
It is the free clinic of Culpeper.
Free clinic of Culpeper. Okay. Anyway, we have the Fauquier free clinic, so I know. I confuse things. But her job is so unique because she deals with such a diverse demographic. There are barriers like language. Somebody comes in with a foot that hurts and really hurts, but then they might notice something on their skin, and that's not a conversation they can really have because of language barriers, right? Yeah. But I know you do. Mm-hmm. So just worst case scenario, somebody comes in with a finger that hurts, and you say, hey, that's quite something on your hand. Mm-hmm. Well, how does that look? What happens in that case?
So, again, a lot of education. We have a lot of translation services available to us, either through electronic devices or we have some staff that's bilingual. Again, the health literacy, the understanding of basics of health, from everything that what happens at a doctor's office to, how do I eat healthy? How do I take care of my skin? All of that is very, very low with our patients. And honestly, I think it's low for a lot of people, but our particular patients, it's really low. They may come to us, especially the individuals with a different dialect, from an area where they have not had any formal health care. It's been, very rural areas where they've learned things from grandparents or whatever. So it's very, very important that we do a lot of education, and we try to do it in a way that is culturally sensitive, obviously. So I think that's the big piece to the puzzle.
Right. And it's a complex puzzle. Mm-hmm. These are not, people are coming in with up and down solutions. They want something yes or no. Mm-hmm. They really don't want to discuss what's on their hand. Mm-hmm. And they may not be able to discuss. So in those cases where you really see something that's quite big, do you send them to the emergency room, or how's that look? What happens there?
We can either, if we think it's emergent, that it needs emergency room care, we can do that. We can also refer to specialists, which is very good. We have our patients fill out UVA financial aid forms so that they can get some help to go see specialists.
And so, we talk about not being able to speak English. How do you fill those forms out? And what are you doing in that role to help?
So, again, we do have some bilingual staff, some bilingual volunteers. And so we sit and make sure that those are done so that they get that care, because they're not going to go if they feel like they have to pay for it. It's the same as a lot of people wouldn't probably.
Well, you have some, we talk about rural health and the hurdles that come with rural health. You have significant rural health challenges because of the amount of language barriers there. And it's so interesting to me because literally you're an hour from Washington, D.C., not to mention other places like Warrenton, which is it is a rural setting, but it's a rural setting in transition, I think. And so, Tammy, thank you for your amazing work and for being here today.
Thank you.
And we have the next one. Some of you may know Rob Marino. He's a Less Cancer board member and is so helpful to us. Rob is a social worker and is the executive director of the Fauquier Free Clinic and a local hero here by many. So
true.
Right, so true. Anyway, Rob, take it away. And can you tell us a little bit about yourself, your history, how you got here, what that looks like?
You traveled from New York to Richmond to here. I live about 400 yards from this spot, so I think I had the shortest commute. And I'm ashamed to say I drove here. Some people saw me get out of the car. I might try to fib about that. I am the director of the Fauquier Free Clinic, which is right down the hill from here, easy walk. And we serve this community. This community is very important to me because it is mine. We serve folks who live in Fauquier County and Rappahannock County, and they have to either be completely uninsured or we serve folks who have Medicaid plans as well. The average income in this community is very high. This is a wealthy, well-to-do part of a very wealthy, well-to-do state, but there are a lot of people who are left out. The average income, there's lots of ways to measure it, but it's a household might make $130,000 in Fauquier County, and that's right at the median. The average free clinic patient household is living on about $15,000. And typically, like our most common arrangement is a family of two. So like a single parent is a family of two, the way we count it. So imagine you're trying to access advanced healthcare or specialty care like a dermatologist or surgery services, and you're living on $15,000 a year in this community. There's no money for preventive care. There's no money for elective care. People do what we've been talking about, which is they wait for something to hurt or to be sick or to have an infection to seek care. Our clinic is open 5 days a week now. We've grown and grown and grown. We see about 2,400 people who live in this community every year for about 12 or 13,000 clinician visits. The patients who are eligible for our clinic are seen for free. And so we're trying really hard to be a primary care outpatient clinic for folks so that economic reasons are not why they're letting things go. All of the problems we've been talking about where people tend to wait for things to be a problem before they seek help are true for us too. And our clinic was founded 30 years ago sort of as an urgent care for people who couldn't pay to get health care. So, the way that we have tried to rotate over the years is to move to more prevention, to have relationships with patients. We've been very fortunate that clinic started about 5-6 years before I was there, but I've been there for 25 years.
Yes.
And a lot of people, thank you, a lot of people who work at that clinic were there before me and they're still there. So I really think that's our special power is that if a patient comes and meets a doctor with us, they're very likely to be able to see them again, and then maybe again, and then have a relationship. And that's where that trust comes, that they learn that it's a place that's safe, that is going to treat them with kindness, and maybe that's makes it easier to kind of grease that next step of coming and asking about something that you're concerned about.
Rob, I remember when the free clinic opened, and it was open, I think, 1 day a week, 2 days a week, and
That's right.
And the blood pressure component was a big deal at the time. Now, Rob undersells himself, but thousands of people have been seen through the free clinic. Thousands of people have been seen, not just for the things we're talking about today, but things like oral care. And as we were discussing earlier, this is all part of access. And if we want prevention of any disease, we have to make sure people have health access. And so the pressure is great for these free clinics now, really great. And they're seeing probably more people than they've ever seen before, more frightened people, and people who are afraid to seek care because they might not be from here but need care, or people that are afraid they can't afford care. And so they're really doing incredible work. Can I say the Lord's work since we're in the church? Right? Is that okay? Yeah. So anyway, they're doing spectacular work, and we are grateful for them because it is this access and this trust and these relationships. Rob talks about being there for 25 years. Many of our kids here have worked in that free clinic. My daughter has.
That's right. We're very proud of it. And, I think we have a special community, but I think there are communities all over this country where people get a little cynical or things have been a little tough lately. But I really believe that all of us are looking out for each other. And, we can lift that up and celebrate that. And I really think that's what makes a community, and we sure have it here.
No, we sure do, and we have it in a lot of places. There are a lot of people that do care, and there are a lot of people that will seek this out. So we are so grateful for your leadership. Rob, while we're talking, what is the biggest barrier for a patient of yours coming in? What's the biggest hurdle, or in their, not necessarily a reality, but from their view?
Sure. A lot of this today is about if you see something, say something, encourage people to seek care. A lot of the reason people don't seek care is financial, is economic. It's not just health literacy, but it's a fear of what that's going to cost and what that's going to mean. Mm-hmm. The typical family I was talking about, they're living on $1,250 a month. If you go to the doctor, it's $200. And that's, there's labs and there's other services. If you're going to a dermatologist, there's probably going to be a biopsy and further care. Now you're talking about a fifth or a quarter of that person's monthly income. Mm-hmm. Nobody's going to do that unless they really think something is wrong. People don't seek preventive care the way that I wish that they would. So I think that's the biggest barrier is fear of that. In this community, if you hear that from somebody, send them to me. We will. That is not a barrier. That should not be a reason that somebody doesn't complete that screening. If you see something and they say, well, I'm not paying to go to the doctor over that, I don't think it's anything, you push back and tell them that we have options.
Give them a ride.
Yeah.
Better
Right, give them a ride. So we hear from people all the time that are not buying their prescriptions so they can eat, and I understand that.
Yeah.
Since I've been running this organization, I've often had 2 jobs, mostly for income for healthcare. It's expensive, and they talk about caps on prescriptions, but they don't approve those prescriptions till July, and so maybe that cap, it's like a never-ending cycle. So the work that both you and Tammy do in providing access is key now in prevention. And I also want to say, early on when we talked about prevention, people thought it was more of a luxury, that it was a type of wellness for people with wealth, that it was an out-of-touch conversation, that it was, and that's what we've been working for 2 decades. So everybody has an opportunity at prevention. So it isn't just a rich guy thing. So it's a thing that we can all pursue. And we know that when we get these treatments, and we're able to get treated, it's super helpful. So go ahead. I'm sorry, Tammy.
I just want to say also, when Rob talks about, the cost of medical care, we're also talking about those people losing time at work.
Fair enough. Yeah.
And the other thing that both of our free clinics try to do is have evening hours and different hours so that those people do have access. Because again, if we're talking about access, we're not just looking at cost, we're looking at it'll take me 2 to 4 hours away from my job.
Not to mention kids.
And the kids.
The kid thing is, is significant. And when I, a million years ago, worked at Children's Hospital in D.C., I didn't understand why mothers weren't showing up for their kids in intensive care. And they're like, dude, they have 3 jobs. Like, get a life. And I didn't get these things at first. I didn't understand how it's not the same for everybody. It's just not the same. And so I think when we talk about prevention, I like to talk a little bit about the judgment piece of that, like not taking care of yourself. Some of those things has very little to do with it. This is really about access. And so while fitness and nutrition are critical, there are lots of things. You were going to say something here.
One of the things that unfortunately have seen coming through the ER, medically we have a definition between acute and chronic. And a lot of things that patients see as acute are actually something that are chronic. And we unfortunately have to see them at that point in time when it's a chronic state. And then we have to sometimes, I know just in this month, we're in December, we're 3 days in, we already gave 4 people the diagnosis of cancer. And they're hearing it for the first time through the ER physician. And so that whole prod of not going and I often tell people that you'll spend more time worrying about the crack screen on your phone or your brakes squeaking before you'll deal with something that's a hitch in your giddy up or a sore that won't heal. You'll deal with the other things first before you seek that. And so they come in, they'll wait 8 to 10 hours in the emergency room just to deal with something that they could have taken care of years ago sometimes.
Absolutely. No, you're right. I always think we're coming to Eugene Triplett next, pharmacist, minister, organic farmer, superhero. But we did a workshop a few years ago that I want him to talk more about. Where he's like, Bill, it was a prostate cancer thing in Standardville. He said, men take better care of their cars than they do themselves. And you, Monica, were talking about how wives and women were an important part of getting men to get health care. let me tell you, Eugene had this church filled with women, and he sent out a church full of raging women that I mean, raging. He had them whooped up. They were saying hallelujah. And he's like, no, we're not praying. We're getting these guys in the car to the hospital. And he was amazing. And I think like in a month, they had 3 diagnoses from Eugene's, the project we worked on, all successful. They're all living and doing well, so anyway, I'm going to turn you over to Eugene Triplett. And Eugene, can you give us a little elevator speech about what you do?
Well, yeah, good evening. I wear a lot of hats. Like I said, I'm a pharmacist, I'm a farmer, I'm also a minister and pastor of the church right now. And so one of the things I would like to say about pharmacists, and this is my spiel, we're one of the most accessible healthcare professionals out there. All of these, if the emergency room, the doctors, and everybody here, you have to have an appointment to get in to see them. But most people just walk into the pharmacy and they come up and they'll talk to you and say, hey, can you come back here and take a look at this spot I've got or whatever like that. And so we are accessible. I have this thing with my sister. She's a nurse, and up until maybe 5 years ago, pharmacists, we used to brag about it. We were the most trusted profession around, but now nurses have overtaken us. Doctors are second and pharmacists are third. So, and I think that's because the price of prescriptions have gone up so high. So when you go into your pharmacy now and you're used to paying $5 and the next time you come in it's $250, they don't really trust you that much. But getting back to what Bill talked about, we talk about when you see something, say something. And what happened to me, I heard something. And I was in a barber shop and I found out that Madison County has the second highest incidence of prostate cancer in the whole state of Virginia. And I'm in Culpeper, but Madison County. And we were in the barber shop one day, but some of the men here, I always say, black men and black women at least go to the hairdresser at least once a month. My wife goes sometime twice a month. I don't. She gets all of this different type of hair. She comes back with different types of hair and get her nails done. But we were sitting in the barber shop and we got to talking, and one gentleman said, he was saying, I have to get up, 2 or 3 times a night to go to the bathroom. And as men, we always want to outdo somebody. And one guy said, 2 to 3. He said, man, I'm up 5 or 6 times every night. And I'm sitting there and I'm saying, something is going on here. And so we did have that workshop, and of the men that at the church that we were there, of the men that showed up, none of them, but 3 of the women went to the workshop. And some of the symptoms, we had physicians there and they talked about it. And they went home and they said, you need to get to the doctor because you're getting up and you might. And so we actually had 3 people in the church that were diagnosed with prostate cancer, but they caught it early enough. And so that was one of the things. And as Bill was talking, my thing I wanted to do was to have barbers to be able to do PSA tests, because barbers are licensed and beauticians are licensed. And most men don't go to the beautician anymore, but we all go to the barbershop. And if barbers could take a PSA, just draw a little sample of blood anonymously, whatever, I think we would catch a whole lot of men, with prostate cancer. So, that's kind of my spiel.
Well, it's not kind of your spiel. You've saved lives because you did say something, and saying something is critical. But I also think your role as a pharmacist, especially in rural communities where people bring all kinds of things to pharmacists, like my arm doesn't work, I fell down the stairs. Well, maybe you broke it, right? I mean, they get every possible question known to man, excuse me.
Yeah.
And so people are showing them their skin, they are responding, and they are really, in their role as pharmacists, triaging people to healthcare beyond what they can do. But they're saying, yeah, that's a good reason. But Eugene is also a local hero for so many people here, and we've Les Cancer has been very fortunate to work with you and your churches and your coalitions, and he really is quite amazing at whipping up attention for healthcare access
and
all the
Tammy
things.
helps a lot too.
Pardon me?
Working with Tammy keeps me in line.
Well, these guys, they seem innocent, but they have lots of dark arts, let me tell you. They make a lot of stuff happen, and they're amazing people in our community. I wanted to just close with Eugene for a second about the impact of your workshop specific to prostate cancer, even though we're here for skin cancer. It really was transformative. And Eugene put together a coalition of churches. It wasn't just like 3 people from his church. He really pulled other forces in, and it was a great collaborative. We had Virginia, UVA, were the medical consultants on that and directed that. But the fact that Eugene did hear something, he did say something, was amazing. And we all have the power to really save a life. Yeah. We really do. When we see something and we can make it a community observation to a healthcare action, it's really critical.
And I think one of the things you can see with the panel here, we all interact with our patients. And, hopefully we see them before they get to the emergency room and before they go whatever. But like I said, they're all saying no man is an island. So we all collaborate together and we work together. And I think that's important, even with the church community. Like I said, in the churches, I see a lot of people in the pharmacy at least 3 or 4 times a month. Mm-hmm. Hopefully we see people in our churches 4 Sundays a month, but that doesn't always work. But it helps. We are a community.
And and Eugene has come to Capitol Hill to help educate legislators as well, along with Tammy and Rob. Super helpful and all really fun to work with. But when we're talking about prevention, I want you to think of access and the ability to be able to connect the dots. For so many people, they can't or don't understand the power that they have to do so. And I'm not putting that on them. It's a team effort here. We're a community, and we're a community here and in many places. And it takes all of these people to make that happen for millions. So we're super grateful. Next up, I want to talk to Caleb Runyon. And Caleb is actually a friend of my daughter, who is a 4th-year medical student. And he had reached out because his grandfather has melanoma, and he wanted to start a project and his mother's a hairdresser who's a wonderful woman, and he wanted to see if I could bring attention to this issue. And I was like, yeah, let's do workshops. Let's figure this out. Let's make this a workshop and a bigger conversation and not just a soundbite. So I'm going to let Caleb tell you a little bit about himself, and take it away, Caleb.
Hi, guys. So my name is Caleb Runyon. I'm a nurse practitioner, and I specialize in dermatology and acute care surgery. So as Bill said, my papa was melanoma, and my mom is a hairdresser. And so when I started working in dermatology, I had a ton of my patients who would say, my hairdresser noticed this spot. She wanted me to have it looked at, and here I am. And 8 to 9 times out of 10, it was something cancerous. And so in the back of my mind, I started to think, hairdressers are so powerful. Hairdressers are so in such a unique position that they're noticing spots without even having the education to do so. And so in the back of my mind, I thought we could definitely, market this and educate hairdressers. But I tabled it. And so a few months later, my grandfather was diagnosed with stage 4 melanoma, metastatic melanoma. And he is 76. He's from southern West Virginia. And you will not see him at a doctor's office. He hates going to the doctor. And I understand it because, he's 76 and he has issues with hearing. And so if he's going to an office and leaving more confused than he started, I wouldn't want to go either. but he gets a haircut every 3 weeks. And so I decided, let's do something so that his barber or someone's barber may be able to help identify these things and prevent stage 4 melanoma, And so, yeah, Bill and I discussed doing some workshops, and it's grown so much from there. So, the Closer Look Project is the project that I started. It's a small business now. And let me ask you, who in the room, raise your hands if you can see? How many of your eyes work? Yes? That's the whole premise of the Closer Look Project. If you have eyes and you can see something, then we encourage you to say something, and it doesn't have to be something like, oh, this is melanoma, stage 4 melanoma or in situ melanoma. If you think something is abnormal, then you should say something. And it comes from a gentle, caring place. But the Closer Look Project takes it a step further. We say, see something, say something, but what do you say, right? So we kind of have established an educational program for personal care professionals, which include hairdressers, barbers, nail technicians, massage therapists, tattoo artists, anyone that gets up close and personal with skin. And we educate them on the signs of skin cancer, what may be cancerous, what is not, and how to have the conversation as well. That's something that a lot of people have mentioned today. How do you say it gently? So we provide a lot of resources in terms of how to approach that conversation. And then the other arm of this, which I'm really, really proud of, is we have a referral network. So we connect with clinics around mostly East Coast, but around the world. And if a hairdresser notices a spot that's concerning on their client, they then have the ability to refer them to a client in their region. To a clinic in their region for timely care. And so the average wait time in the United States for a dermatology appointment is 2 months and 5 days. And 29 of those days are getting in just to your primary care, which is, significant. It's significant because then you get an assessment, they start the referral process, and then you wait another month and a half or so. So our program cuts that down by 50%. And most of these clinics are seeing clients within 48 hours. So that is the Closer Look Project. And I'm going to be talking to Rob and Tammy after this too, because we have 5 clinics, 8 locations, and 2 of those are free clinics, and 1 is an FQHC. So, reaching out to people who have means and resources for clients without having them break the bank is also a consideration. So that is the Closer Look Project.
And these things all work because of collaboration.
Mm-hmm.
And we live in a world today that collaborating is complicated for people because they're worried about their self-interest. But if we share this interest of health, human health, public health, and caring for our communities, we're all on the same page. Then we don't have these hurdles, right? Caleb, you're going to do a demonstration with Ali from 68 Main. And do you want to go over here
Sure.
and start that? Thanks, Ali. This is Ali, everybody, if you don't know him, he's a hairdressing hero here. So, right? And barber and guru and community leader. And take it away, Caleb.
Yeah, so a big consideration as well with, can you hear me okay? Okay. Is how do you even do a skin assessment, right? And not that I want you guys to be proficient with a skin exam or a hairdresser to be proficient with a skin exam, but just knowing like what areas are concerning, which areas require a bit more attention, and what areas are more exposed to the sun, which areas are missed with sunscreen application. So those are the things that I want to kind of focus on today. Ali, I'll have you remove your glasses if you don't mind. No. So I always start out with a view that kind of just takes a look at my client's face and seeing anything that I straight away what is concerning to me. And so, I'm not trying to diagnose him today. If there's something suspicious, I'll likely talk to him afterwards. But looking at the face from a whole perspective, that kind of gives us a micro assessment. And then we know where to zoom in on. Okay, so typically I'll start from the side and kind of work my way around. And so which areas would be the most concerning for men especially? Well, I would say the ears, behind the ears, and the scalp. A lot of us are thinning up top, myself included, and so I forget oftentimes to put sunscreen there, and I'm sure that you do as well. And so that is an area that the sun has direct view of all day long that you're outside, or if you're driving or whatever. So that's an area to be mindful of. Behind the ears and in the ears, in that conchal bowl region, that's another area that's concerning. So I typically will start on the side here and just take a quick look. Now, you see, most of us have these kind of like lines here, laugh lines, smile lines, wrinkles, whatever you want to call them. You always want to kind of take a little bit of a deeper look there. Good. Great. So, this region here is getting so much sun exposure, right? So just something to be mindful of. And if you have a wide part, if you have blonde hair, if you're bald, these are things to consider because sunscreen, you probably aren't putting it there, right? Who thinks about that on their head?
And Caleb, what are you looking for? Certain
Yes. So
what do you
So I'm looking for anything that's different from his skin tone. So, he has an even skin tone here, but if you see something that's darker, for example, here's a little maybe ingrown hair or something there that's a little darker. I don't know if you can appreciate that on the screen, but if you start to see something that's discolored, if it's ulcerating, if it's bleeding, if it's itchy, those are abnormal signs, right? How many of us have itchy spots all the time? You shouldn't, by the way. So those are areas that you should probably check in on. So that's what I'm looking for. Any indiscrepancies with the skin tone there? Good question.
And when do you do this kind of exam, Caleb?
So with these exams, I typically will start, like in clinic, we do these once every 6 months, once every year, for hairdressers, I think it was, someone mentioned that your wife goes to the hairdresser twice a month, right? And for a lot of women, my mom included, do not touch my hair, do not touch my scalp, but her hairdresser's got her hands all in there and she's very happy to have that. And so what a better time to take notice. And you don't have to even be, you don't have to announce, oh, I'm parting the scalp and parting the hair and looking at this scalp. I'm looking at this spot. I'm looking behind the ear. Just be mindful and just kind of just take inventory of what you're seeing.
Yeah, Caleb, and I would just add, I think one of the other things about those of us that go to the same stylist is that you'll notice if something has changed. So it's not
Correct.
just the one time.
It's not just the one
over
time.
time, there may be something that's growing a little bit larger or maybe changing color or shape.
Yeah. So, if I see his scalp today and I see it again in 2 weeks, if there's a spot that I don't remember seeing before, well, I'm gonna speak up and say something to him and, possibly recommend a referral to a clinic. So that is basically the scalp exam. It's pretty simple. Like I said, I don't go into the weeds on this because what will you benefit by knowing that the top layer is the epidermis? Nothing. You're not going to benefit from knowing that. So just knowing that if something looks unusual, you should say something. Okay.
Also, too, I just want to bring up, but we did this when we did this workshop in West Virginia. We talked about nail technicians and we talked about tattoo artists. We had our candidate then was a bald man covered in tattoos, which is more challenging. And he was a barber, and was he also a tattoo artist?
Yes.
Yeah. So he had a lot of skill sets there, but it was interesting because we were talking to nail technicians, and on black and brown skin, we see a streak in a nail or a spot in a nail, but you say something, you send them somewhere, but there's this opportunity to say, do you want me to paint this nail? Do you want me to paint this nail? Are you going to take this nail off? Are you going to take this polish off when you go see the doctor? So those were the kinds of conversations we were having, and super successful. Yeah. We had a whole cosmetology school at that event. And it was interesting.
Yeah, it was.
So thank you, Ollie, very much. I appreciate. I called Ollie to see if he would be our lab rat, and he was so willing. Yeah. And we're so grateful for Ollie and the great work that he does here in Warrenton. And we're grateful for Caleb and really having important conversations. Caleb, thank you for introducing us to these great ideas, and also to your wonderful town of Logan, West Virginia, where we had so many great people. It was a lot of fun.
Thank you.
So next up, we have a superhero, or as our parents call it, a star. Yeah. And she is a star. And so Kimberly Madison is from Texas. So let's hear a little bit about your journey and you. And Take it away.
Well, first, I want to thank Caleb. Caleb's the reason I'm here. And then he introduced me to Bill. So I just want to recognize that. And super excited to meet a pastor who's also a nurse. Oh my gosh, we're everywhere. If you didn't know, there's over 5 million nurses. And even though we're the largest segment of the healthcare workforce, a lot of people still don't know what we do. So thank you for the opportunity to even talk about nursing and nurse practitioners specifically. But when it comes to what I do, I'm an expert in health literacy. And health literacy is taking complex medical information, some of what we're talking about today, and breaking it down into information that you understand so that you can obtain it. That's that whole access piece. You can understand it. It makes sense to you. Put it in your own language and then use it when you go home to manage your health and advocate for others. That's our theme here, is advocacy, because you're only with us for a few minutes, but you're with yourself all the time. You have to know what I know. And so it's very important. So I am the daughter of Reverend Leona Madison from New York and retired Marine Pierce Madison and my brother Pierce Madison. I grew up in Quantico. Then after that, I went to Stafford and Alexandria before I moved to Houston, which is where I'm coming to you from today. So this is my home, and I love anytime I can be a part of the community. I am a reader, a writer, an entrepreneur. I love adventure, and sometimes I take care of patients as a nurse practitioner, a doctorally prepared nurse practitioner, and I come to you with my lens in healthcare as someone who studied biology, biomedical engineering, and then, of course, nursing. I became part of the healthcare industry. It is an industry. It's a whole business as a freshman in high school. So I've been doing this for a little bit. So that's what I do, and that's who I am.
Well, we're grateful to have you. And I don't know, Kimberly has her doctorate in nursing.
Doctor of Nursing Practice.
Yeah. Mm-hmm. And is an important educator, especially when it comes to Black and brown skin. Can you tell us a little bit about some of the myths that come with skin cancer, Black skin, all the stuff you know? Can you share that?
So I was invited to speak about why the health outcomes are so poor in Black and brown communities. And so that I'm a big research nerd, so you're going to hear me say data probably 100 times. So there was a big report that was released called the Flexner Report. And that shows that, I don't remember when it happened, but the medical model that we have in place right now was borrowed from Germany. And in a lot of ways, the science, patients are there to serve the science as opposed to the science serving the patients. And if you've been a patient, you have probably felt that way. That's why my dad used the word guinea pig. I hear that all the time from my patients. And so what happened with that report, though, is it kind of, because they put those standards in place, automatically all the medical schools that were in existence at that time had to meet a new level of standards. And unfortunately, a lot of historically Black colleges and universities didn't meet those standards. I think only 2, Meharry and Howard, the real HU, left standing. So that eliminated a ton of Black and brown doctors. And so now that determines now who's in these positions to speak, to teach, to conduct research, to determine marketing policy and regulations. And so that trickles down. And so right now, as we're speaking, less than 5% of dermatologists are Black or brown. And in nursing, we don't even know the numbers because nobody collects that data. When it comes to dermatology in general, unless you go to a derm residency, even you're not getting it. So you can go to someone who's been a primary care doctor, emergency physician, internal medicine, vascular, for 30 years, and they still have almost as much dermatology experience as you do, except that the skin is the largest organ. So no matter who's walking through that door for no matter what reason, there is a chance that whatever problem they're having, we can see it on the skin. And they might be the first person to notice something. It's the first time to see an early detection that there's something going on internally that we need to take a look at. So, over 20 years ago, the current president of the American Academy of Dermatology, Susan Taylor, the first Black woman to serve in that position, created Skin of Color Society over 20 years ago, which, by the way, is how long nurses have been the most trusted professional. Just want to put that out there. The only year that we
Can
were...
you name that society again? I didn't hear that.
Skin of Color Society.
I gotcha. Okay.
And their mission, of course, is the same thing I'm talking about: increase outcomes for Black and brown communities when it comes to dermatology. The only year nurses were not most trusted was when we had when the towers fell. That was the only year. 9/11. The firefighters beat us. Okay. So even though the Skin of Color Society has been out, they'll have webinars, we have special initiatives by all kind of organizations. Even still, over 20 years, still the number of dermatologists are still black that are black or brown of 4%. So that's going to matter when you go see someone. So in our dermatology textbooks, any medical textbook, nursing textbook, you don't see brown images. When you go to those research, that data I'm talking about, we're not in those studies. Part of that Flexner report, Tuskegee, all kind of experiments on women that were not given proper pain medication so we could study gynecology. There's so much history when it comes to why there's no trust in black and brown communities. And so when you say, I want you to be part of this research, I'm not going to trust you to participate in the research. Maybe I'm not going to a place where you are dominant. I might be going to this one place where everyone looks the same on very light skin. So when I tell you this medication works for 10 of the diseases that you have, but none of the people who were in that study look like you, and you're like, hey, this doesn't work for me though. Why come it doesn't work for me? And then we're frustrated because this is all I have to give you. And you're frustrated because your problem hasn't been solved yet. And so you see that show up in who's conducting the trial, right? I know what problems affect me and my community. So when I'm the one that's the problem solver, I'm going to talk about problems that affect me. So when I conduct a research study, I'm conducting studies that impact me and my community. Same when it comes to policies and FDA regulations. So right now the regulations are for sunscreen that you don't even have to test it on darker skin tones, which is why when you go to the store, most of the sunscreens should have that white cast, because as a company, I wasn't forced to test it on everyone. So it trickles down in everything that we see. And so we're going to talk about why it's often missed. Well, first of all, there's just that lack of dermatology in general across the board. If you don't go to residency, you're just not really going to get it. And then the brown skin. Again, everything is taught that it's going to show up red. Well, my skin, depending on the tone of my skin, it might not ever show up red. So if you're telling me to look for things that are red, I'm going to miss it every single time. So instead, when we're talking about red and a light skin tone, it might show up gray or brown or black or gray or ashen or purplish hue. So that when he was talking about looking just for changes in the skin, that's what you're looking for, just changes in skin color. And I love that you all are experts because you have seen normal skin thousands of times. And that's the same thing in our training as nurses. We first study on skin that's on everything that's normal. So as soon as you see something abnormal, it's going to catch your attention real quick. And that's all we want you to do. This looks a little abnormal. I'm going to say something. I don't know what it is, I can't answer all your questions, but it looks unusual than what I see thousands of other times. Same thing, right? So let's get to some of these. Do you want me to just go down the list?
No, I wanted to stop you for 1 second. This woman has got so much information. You have to be like a speed listener. And she's so great and passionate about what she does. But I wanted to back up to some of the trust issues that we talk about. And I think a few years ago, we did something on Henrietta Lacks in D.C. And if you've not read the story about Henrietta Lacks, please all check it out. And it will give you a snapshot view of why there are trust issues in healthcare. And so part of our job, everybody's job here, is to create those relationships and trust and take people from where they are. And really, but it isn't just like, and I know that when we were at Eugene's church, he really had to whoop he was powerful on this issue in getting people to doctors. And it is, especially men and prostate cancer is not happening for a lot of communities. And so I just wanted to pause for a second to talk about how it's really a historic issue, especially for people of color. Mm-hmm. So I'm sorry.
No, that's a really good point. And it's important that you said that, because so that gets passed down, right? My grandmother tells me, my mom teaches me the same thing. So it gets passed down, even if I personally didn't experience it. And that shows up as a healthcare provider. Just because someone has a license or a certification, it doesn't mean that they're still a person. So they're still carrying that into their appointment with you. And so you have to still continue to speak up and say something and advocate for yourself. Just because they're wearing a white coat, it doesn't mean they know everything or that they're going to address everything, especially if they're not comfortable. And so an important thing to say is, yes, you might look different, right? Caleb is going to look different than me, but all Caleb is going to say, like, look, I'm really passionate about skin of color, and I've taken the time to learn. And I might not be able to have the answer for you right now, but if you're willing to be patient with me, I'm willing to work with you and we can figure this out together. And that's all any patient or client wants to hear, is that someone cares enough to work with them. That's it. Right? Because I can look at Caleb and see he's not a black man or a black woman, right?
Really?
Yeah, right? And Caleb can think, oh, this conversation isn't for me because I'm a white man. But it is, because there's not enough skin of color providers to treat all the skin of color patients. Same thing with your stylist or a tattoo artist or a nail tech. There's not enough of me to go around. So everyone has to have that information. So when you see those kind of presentations that say skin of color, that doesn't mean you're not welcome. You're absolutely welcome. We need you there.
Well, also, too, I want to point out, she brings up such a great point, because when we talk about public health, we're talking about community health. We're talking about our health, no matter what color we are. So we have to really pump the brakes a little bit and be able to see beyond what's on a spreadsheet, beyond what's in a white coat, beyond what's on a stethoscope, and really understand where people are coming from. And so that empathy is critical when we're in the personal care business and we may be looking at people, and it's important to understand where they may be coming from. You know, I'm originally from Detroit, Michigan. I'm 66 years old, but when I moved here in the late 70s, it was shocking to me that segregation wasn't that far away. Things I didn't even know about were not that far away in the late 60s and even the early 70s here. So to put myself in the shoes of that experience is almost unimaginable. I mean, you work at it, you try it, you understand, and you're horrified by it. But it gives you an understanding why people come to where they come to and how they come about thinking a particular way, because for centuries, they were not seen or mistreated, and it was a whole thing. Fortunately, we have leaders like you, and we're so grateful for your leadership. Is it okay if I just ask you a couple of questions here? Mm-hmm. So, can we talk about sunscreen a little bit? Like, people are like, "What do black people do with sunscreen?" I was like, "What do you mean? What do black like?" But you go ahead. Tell us a little bit about that experience, what that looks like.
I love talking about sunscreen. So I've already talked about policies and what you're seeing on the shelf. And the same thing with marketing. If you're going to put out a campaign about sunscreen and why you should wear it, you might not see people that look like me on there. So I don't even know that you're talking to me. And a lot of the messaging is going to be around preventing skin cancer. And that's true. We do want to prevent skin cancer. But we also know, based on that data that I talked about, that whilst people who are black and brown might get skin cancer less often, when we do get it, it's at a much more advanced stage and we're dying because of that. And so it's hard to get people to think about something they haven't experienced. So you want to address where they are right now. What do they care about right now? They care about their skin looking healthy. They might not care about like the fine lines and wrinkles that you hear about when we talk about aging. But if they just went and got any chemical peel or microneedling or a facial, they care about that money they just spent and they want to stretch it out. And if they wear that sunscreen, it's going to increase that investment and take it much further. So you can always address things like that. You're going to hear them talk about, oh, these dark spots. They're not going to say big things like hyperpigmentation, but these blemishes, and my skin's not as even tone. Talk like that, because that sunscreen is going to help prevent those uneven skin tones and blemishes from getting worse. They care about that. And our men, we love our men. They don't want to look like they're wearing makeup, right? And so hopefully we can all provide our favorite sunscreen, and you'll have multiple options to tell them. My favorite is COTZ, coats. And so the data shows that we talk about skin cancer, and the risk of getting skin cancer is from rays, right? UVA and UVB. A for aging. Everybody say UVA is for aging.
UVA is right.
So UVB is for burning.
UVA is for burning.
Right? And so that sunscreen helps protect against both of those things. But when we look at black and brown skin, additionally, there's visible light. So we have three things that are coming at us. And tinted sunscreen specifically helps to protect against that visible light. So we really want all of our skin of color patients to wear a tinted mineral sunscreen. So there's two kinds, right? Chemical and mineral. The chemical one is like, it's very elegant. You usually have the white cast and people really love it. However, Caleb sees them show up all the time because they're having a reaction to that chemical sunscreen. So he's going to say, I want you to wear the mineral sunscreen because you're not going to have as many reactions. So all you have to remember is if it's tinted, it's probably already going to be mineral. So if you remember tinted, you're good to go. And when there's black and brown, we want that SPF to be as high as possible. So 40 or 50. And then that's going to be great for your men, right? Because it's not going to look like makeup. And I think those are the main things. Oh, wear it every day. I don't care what time of year it is, whether you're indoor, outdoor, because visible light is everywhere. The rays are coming in here. Even if you're a truck driver, you're on the airplane, the light is everywhere. We put it on every 2 hours. Even more if you're sweating or swimming. And even if you're at that ski resort, I still want you wearing that sunscreen. Okay? I think those are yeah.
So I sit in front of you, computer off. So does the sunscreen also help you with
Yeah.
things that are coming from there?
Yeah, because you got light's coming from everywhere. As long as the light is on,
I gotcha.
then you want sunscreen on.
I have a question to you.
Yeah.
They say that the sun is necessary to maintain proper vitamin D and immunity in the system.
Mm-hmm.
Do sunscreen block that benefit?
No, you're still good. So the truth is, most people aren't going to put on enough. So you're still going to get the vitamin D that you need, and vitamin D is very helpful. But really, you're only going to know your adequate level of vitamin D if you get a blood draw. That's really the only way to know. So you can spend 20 minutes every day outside, and you're still not going to really know unless you get. We're all about the numbers. If you can show me that your numbers are good, then that's fine, and that should determine your dose of your vitamin D every day. Good question.
Yeah, I just have a quick question. Well, maybe it's not quick, but sort of second generation hippie here, right? Long-term member of the wellness community, whether I wanted to be or not. And in sort of the alternative health community, we've seen a lot of real big misinformation coming out, right? And we know that's been really problematic for a variety of reasons. And one of the big trending topics now is that sunscreen isn't safe for us, right? I don't know if you're aware of that, but
I've heard it.
In my world, it's a big deal. And it's really frustrating because my friends are very intelligent people and I can't get them to believe that sunscreen is safe. So I'm just wondering if anyone on the panel or you in particular really, would have good pointers for us to bring up to our friends who are presenting this misinformation and making themselves less safe.
Yeah, and I think that's a great question because people are going to have that about a lot of things. So you really want to get to what is it that they're saying isn't safe about it, and then address that concern specifically. But you can always just go to the amount of data that there proves on that sunscreen or whatever it is they're talking about is helpful. And what we really do in healthcare is we provide people information and we support them in the decision that they make. That's what we call shared decision making. And so yes, we want you to be passionate and advocate for people, but we never want to force people. And in fact, when they see that you're not going to force them, it helps with that trust. And eventually they will come back around to you. So very good question. And by the way, since some of you are in like the aesthetic space, people who are looking for makeup that has SPF, I recommend Bare Minerals. Yeah.
Wanted to ask you a question. People, mostly white people, will say, hey, I use sunscreen. I don't need to go to a doctor, blah, blah, blah. Can you speak to that thinking, why skin checks are so critical for everybody, especially black and brown skinned people?
Yeah, and before we forget the sunscreen, and so yes, he mentioned putting on the scalp, the ears, and the shoulder, anything that's sun exposed. I just want to make sure I don't forget that. Because you can't see everything, right? Even right now, I can't see my back. So I specialize in wound care at the moment, and I do skin checks all the time, and nobody ever understands why I need to look at their skin. And so I explain that it's the largest organ. That's number one. So it's going to be the first place I see any changes. But just the mere fact that I cannot see my back, right? I can give a lot of medical pointers as to why I need to look at your skin, but the one that everybody gets is you can't see your whole body. That's the easiest one. And it's really a sign to see something if there's a problem. And we always want to save you time, money, and stress. And the longer you wait for something, that's exactly what you're going to be dealing with. More time, more money, and more stress.
Good point. Good point. Go ahead.
Oh, the question I have that I get a lot of times is, how do you handle the statement, good black don't crack?
Okay, so the cracking really is referring to that marketing I'm talking about. It's always about the wrinkles and what is it? Wrinkles and fine lines and wrinkles, right? Yeah. So black and brown skin, we do get fine lines and wrinkles, but the main thing that we care about is those blemishes and the dark spots, the dry skin, the sagging, the volume loss. So you want to really talk to people where they are right now with what they care about right now, and use the language that they're using, and just say it back to them. Mm-hmm. Yeah.
I love that. Are there some takeaways that you'd like to leave us with today about skin checks, sunscreen? I did want to add something in about the sunscreen because in my job, I hear a lot of people, Jamie, talk about, oh, what about the chemicals of this or that? And they're, we're now in a world where a lot of people have a lot of platforms and a lot of opinions. It's always about the research. I always like to follow the research. I also like to follow the money too. But people will float these ideas out all the time. Sometimes they're right. Sometimes they're not right. A lot of times they're not right because it's instinctual. They don't understand there's been a process, and science is not a finite thing. Sometimes we come up with answers we don't want. Sometimes we come up with answers we hope for. So it's a big conversation, and the drive-by advice from pseudo science people, probably not so helpful and super confusing for a lot of people because it's at some level it's an answer people want to hear. Oh, I don't have to use that. Oh, I don't have to go. Or, oh, they don't know what they're talking about. Everybody here, is super educated in what they do in helping to get people. There's a lot of science here. And so these are the trusted voices that we need to ask for. When people make those statements, we need to talk about who's your trusted voice. Where's that evidence from? Those are key questions. Go ahead.
Yeah, I was just going to add one other quick thing. I think the point raised in the audience about both misinformation, but there's also disinformation, especially in social media. There are individuals that are purposefully putting information that is not accurate. So just like in any other consumer product, my encouragement to you is to do your homework, really look to see if there are reputable sources for what individuals are saying. Don't always trust Dr. Google because there's a lot of misinformation and disinformation there. So make sure when you're looking at a study where science is saying do this or don't do this, that you're going to the primary source. I say somebody worked in the library, so remember what primary sources are, and our English teacher can help you to remember. Go back to those primary sources, look for that information, look for studies that have been replicated, so just not that one study of 50 people in some place you've never heard of, and then go back to your trusted sources, your pharmacist, your physician, your the folks at your federally qualified health centers or free clinics, and ask them because they're the people that know you best and that are going to be able to help you to make a distinction between what's really true, what's not true, and how you should make that decision.
Also to that point, and I do want to get to Caleb and then back to you, but to that point, for healthcare providers that are here, the continuing medical education credits are from Michigan State School of Medicine. And one reason we do that is to make sure all the science is vetted, that we understand what's going on, but also so the consumer knows there is no special interest here. We are not sponsored by a pharmaceutical company. We're not sponsored by a makeup company. We are very fortunate to be able to do these things with support from people like the Path Foundation, who are out there solving problems every day for health issues. And so we're super grateful to them. But I wanted to be clear that when we talk about these issues of trust, that there's no special interest here. And, it's a tough way to raise money. It's a really tough way. There's a lot of people we can't take money from. So that's, I just wanted to give that. Now, Caleb, go ahead. You have something you wanted to add.
I wanted to add, Kimberly talked about if you're a Black patient seeing a white provider, you're probably going to trust me much less than you would, trust Kimberly, and that's okay. But I wanted to encourage, white providers or providers who are less knowledgeable about skin of color, one, don't be afraid to say black and brown skin. Like I've seen so many white providers that say, first of all, African American, which I think is no longer, we don't say it. Like, don't beat around the bush, and not all black people are from Africa, right? And so that's one thing. Don't be afraid to say that, because it makes you look ignorant if you say African American, or if you beat around the bush and don't want to say black because it makes you uncomfortable. The second thing is, don't be afraid to say, I don't know. I've done that so many times. I've talked to Kimberly about that myself. I had a patient who presented with several moles that looked so different from any mole that I'd ever seen before when I first started practicing. And I was not afraid to say, I'm not sure. Let me do some research and reading. Let's do a biopsy. Let's get an answer. And she always wants to come back to me now. And we had a black provider that she could have seen. So, I mean, it just goes to show that the work that you put in to make sure that your clients are getting equal access to care is going to make you so much better of a provider. And then the third thing is, don't be afraid to appear ignorant, because you may find out that you are, and I found out that I am in some cases. And ignorance isn't an insult; it just means you're unsure. And so don't be afraid to do that, because the way finding out that you're ignorant, educating yourself, that's the way to provide inclusive access to healthcare to all patients. So,
You had a question?
Go ahead.
I had one, but I forgot.
It's all right. It's all right. And everybody can reach out to afterwards. I wanted to.
Number one. Is there a certain color? So I've been told, like, if you wear dark colors, it attracts more rays. Does that have any effect on our skin? Is that true?
It is true, but the main thing we want to talk about when it comes to clothing, because we talk about sunscreen, and that's one layer of protection. They do have clothing that is specially made to also help protect your skin. We want you to wear your wide brim hats, your sunglasses that go around to the side, long sleeves. So those are other avoid the high peaks of the sun during the day. So that's anywhere between 10 and 4, depending if you live in Houston. That's a long time of the day. I think those are like the main things for sun protection. And there's a wash. There's a wash you can put in your clothing, so you can all get that extra layer of protection.
And in terms of clothing, if you don't want to break the bank to get UPF clothing, because it can be pricey, the recommendation is that you wear dark clothing, because dark clothing does absorb the ray and then disperses it. And so if you wear like a light colored shirt, you may get more rays through your clothing, and also tightly knitted clothing as well. Those are two things. So black, actually, it makes you much warmer, but black is much more protective.
Mm-hmm. And that hat too, you want to make it so it's tight. I know some of the the weaved hats have the little cute little holes and stuff, but you really want it to be as tight knit as possible, so you get that extra protection.
To the hat point too, my doctor had said, you got to start wearing a hat. And I was like, I'm not a hat guy. And he said, you know those old men who are missing part of their ears? And I said, yeah. And he goes, you're going to be one of them. and that's another place that you don't see, especially if you're bald, are the top of your ears. And so a lot of guys my age or approaching my age are now missing parts of their ears. So, somebody like me, if I swim a lot in lakes, I wear a hat now. And I look like a grouchy old man with a bucket hat over my head and a shirt on, because a lot of the sunscreen doesn't really stay on as well. So I do it all, but it is the geeky hat is the other thing, and that's what saves the tops of the ears too. So I wanted to ask Tricia Petzel, Dr. Petzel, are you hearing anything you'd like to jump in on here, add to voice?
No, thank you. Thank you all for what you're saying. Kimberly, your articulate explanation of what of this has been wonderful to listen in on. And I think that question of that misinformation, disinformation that people push back for their own health care. And it's those conversations of what are they really scared of? What are they really hearing? And are we able to dissipate some of that? I think people do sometimes react to chemical sunscreens. And so those mineral sunscreens can be tolerated better. And usually when someone's pushing back on sunscreen, in any case, I always promote the mineral sunscreen. So that can be a little bit more of a bridge for people. And then I love, Monica, your point of get to the primary source, because that if we understand what the fear is, what the messaging someone's had is, then the conversation can happen. I mean, I think that's what, so thank you, Bill, for this workshop, because that's where it's starting and it's happening. And so much so many pearls and good advice. And Caleb, thank you for your feet on the ground, and Rob and Tammy. I mean, I'm so inspired today by everybody. So thank you.
Well, we appreciate your leadership. And when she says inspired, we'll be getting a couple calls this week. She's going to have some really big ideas. Because the great thing about this whole group here is everybody wants to end the suffering that comes with a cancer diagnosis. It's the worst news. A lot of us have heard it. And if we can lower that risk for that suffering, it's great. And we have. We have seen these results happen over and over and over. So as the incidence of cancer increase, there is a posse out here of people that are working to lower that risk, from healthcare access to skin education to, all kind of research and ministry. This man here works night and day, ER at night. During the day, he's a pastor. I don't think you go off duty on that pastor gig, do you? No, I think he's pretty full time.
Yeah. Bill, may I say one more thing?
Yeah, go ahead.
May I just say one more thing? Yeah, and I started thinking about Tammy and Rob's clinics, and in my world here, the community health centers are where we get a lot of care for a lot more people. And what I want to just plug is sometimes, and usually, those physicians who work there are some of the smartest physicians you'll ever meet. They're certainly some of the most compassionate physicians you'll ever meet. But I think having confidence when they're caring for the skin cancer, when they're sending off the biopsies and treating it, they have all the knowledge they need to do it. People don't always have to go to a specialist or get into that specialist. And sometimes that's months away. And some things can be definitively cared for right there in your community clinic. And that's often here in Salt Lake how it happens. So and having confidence in those people, I think, is really an important thing, because you should.
Oh, so for the hats, because a lot of, especially Black women, we wear our hair. And so I have to sometimes buy a man's hat in order to get it wide enough. And then they do have like the open visor. So if they have some kind of updo, you can still get that wide brim here and still have the hair going. I did want to mention that. And you only see us sometimes maybe once a year, but you see you guys twice a month. So you don't have to have and we don't either, have the whole conversation that one time. They're going to come back. So just introduce it lightly. And then next time, just continue that ongoing conversation. I'm big into social media. And yes, you do need to have guardrails. But if there's trusted people like you, experts, you just demonstrated your expertise, or you're showing up online and you're sharing information in a way that people understand, that's golden. That helps really balance out the mis and disinformation that we're seeing. When it comes to seeing your skin, yes, you can see anyone. Just ask them their credentials. Hey, how comfortable are you treating skin that looks like mine? You can recommend the website See My Skin. It's a collaboration with Vaseline, Derm's favorite. And people can type in their symptoms that they're having, and they'll see it on diverse skin tones. And there's also a directory, so they can also find someone who can treat them. When it comes to Black and brown skin, it's mostly going to a lot of times show up on the nails, the feet, and the heels. That's your expertise, okay? So that's a little fun fact you can share, everyone.
I got a question about the nails quickly. When people go through the process of getting their nails done, and it's a big deal, you can see a lot of work and energy has been put into it. How do you talk them off the ledge on really examining their fingernails? Is there something that you can do? Like, do you ever say, come to the next appointment without nail polish, or what's that look like?
Yeah, well, when you're in a hospital setting, yes, you can't breathe. I need to get your breathing right now. That nail's coming off. But if you're in your setting and you're coming back in another 2 weeks, introduce the topic, right? And build that trust, gauge their readiness, and go where they're ready to go.
I love that, gauge your readiness. That's a big piece of it, and not losing sight of the conversation. While we're about to wrap up, I wanted to talk to Joe Williams there. Are you there? Can you stand up? Shakes hands like my dad. This guy, can you stand up? So this Joe Washington. I'm sorry. I was looking at somebody else. Please stand up a second, Joe. I'm sorry. He was looking around.
Who's Joe?
You could have said Joe Washington. He still looked around.
No, I know. Listen, Joe here is an amazing force. I'm sorry for for missaying your name, but it is. We had a confusion on a text the other day between Joe and Jason and Joni and some other J person. And Joe was on there and somebody was like, Joe. I was like, yeah, Joe, the guy with the big handshake, like my dad. And he's got a big handshake, so make sure you shake hands. But he has made all of this happen here, really. I mean, from putting the sign up to, managing texts at 6 o'clock this morning and making sure the AV crews were in before sunup, and really a spectacular job. You're such a great community person. Thank you very much. Thanks so much. Go ahead, Chad.
Can I add to that?
Yeah.
This gentleman saved me. I was at Black Lives Matter here one Saturday morning, and the confrontational group of 3 or 4 were in front of the courthouse, and the policeman left. As soon as they left, this tall, skinny, very obnoxious person, he had a megaphone and tried to keep us from having a really peaceful, and that's just a wonderful group of people. And this guy got to my face, and I was getting back in his face, and I was lifted off I had no idea. Lifted off the ground. He backed me up. He stood behind, got behind the group, and he said, "It is not worth it. Honest to God, it's just not worth it."
There you go, Joe. Saving lives. That's when you see something, you say something. Yeah, and he can move a truck, let me tell you. This guy can move a lot. He's a strong guy. So we are grateful for this community, and we were grateful for this opportunity. Grateful that the Pat Foundation helped make this possible and makes a lot of these things possible. And because in public health, it's all about the communication. It's all about the messaging. It's about showing up for your community, being as real as you can, being as present as you can, and trying to connect the dots on solutions for everybody. Not some people, everybody. And we are Less Cancer for All. And so we work diligently 7 days a week to make sure people's access, their care, and all of the tools they need to stay healthy are available. And some days we're better at it than others, but more often than not, these conversations elevate it in a way that have not been elevated before. And Warrenton and Fauquier County has been Less Cancer's home for over 2 decades. And while our work spills into other communities across the country, we will not move. So many people have said, have you thought of moving to New York? Have you thought of moving to Washington, D.C.? Have you thought, nope. Because it started here. Go ahead, I'm sorry. You have something to say, Tammy?
Yeah, I just wanted to say something of gratitude. I want to thank Less Cancer for providing a scholarship for the past 3 years to our nursing students. We all know that nurses are on the front line. So thank you so much for all the hard work that you all do. And thank you, some of you were at our last workshop at our college last October, I think.
Yep.
And I also want to thank the Path Foundation because they helped to sponsor that event and they support our college like everything. So thank you, thank you, thank you.
Well, thank you. And when we talk, I think this year we might have done 5 or 6 small, not huge scholarships for nurses in rural areas. It's critical because we need them to stay there. We need them to serve their communities. And we need to make sure they have as many tools as possible because they are in the front lines. They are our most critical warriors. And I think Dr. Petzel agrees with me on that. And certainly all my nurses friends and everybody here agrees with that. We have to take care and do what we can for nurses. They are the most critical profession we have today. So thanks, everybody. And thanks for being here. We have lunch for everybody, so please eat and feel free to talk to any of us and ask questions.